Hello Adam, is that you? I would be more than happy to talk to your students about SBAR. Pacific Northwest University Cohort Class of 2017. Welcome to the world of medicine. My name is Dr. Richard Kimball and with me is Nurse Jenny.
Hello and welcome. My name is Jenny Liar and we will talk to you about SBAR. Did you know that most errors made in the hospitals are rooted in communication?
SBAR originated as a communication tool for the U.S. Navy with nuclear submarines and was brought to healthcare in the 1990s. SBAR was developed for healthcare by Dr. N. Leonard and colleagues from Kaiser Permanente in Colorado, USA.
SBAR is a technique to provide structure to communication.
With sentinel events or critical situations, it is imperative to make sure the communication is clear, concise and structured.
SBAR can provide you a tool to do that.
As a physician, I entrust my patients to the care of a nurse. I trust that the nurse will notify me if any unexpected changes occur.
As a nurse, I trust that the physician will respond with appropriate care.
Okay, Jenny, let us demonstrate for the medical students how we use SBAR and how they will use it with Dr. Susan Fleming's Washington State University nursing students. Her students are currently in their first semester of nursing and they are from Spokane, Tri-Cities and Yakima.
First, the nursing student will email you, the DO student, a scenario. Then they will arrange a time to call you, use Skype or meet you in person within 2-7 days.
As a physician student, I will want to make sure that the nurse identifies his or herself. Then I will evaluate the SBAR. Well, it is 10 a.m. on a Tuesday morning and I am at the clinic where I see my patients. I am an endocrinologist. I made rounds at the hospital at 0700 and checked my 3 patients and they appeared to be doing well.
And they were doing well at 0700 when you made rounds. However, the status changed for one of your patients and I decided to call you. Hello Dr. Kimball, this is Jenny Liar and I am calling you from St. Helens Hospital about your patient Bill Jensen.
Yes, how is he doing, Jenny?
Here is the situation. I am calling about your patient Mr. Bill Jensen. This morning at 9:30 he was extremely lethargic. This was a repeat of yesterday at the same time. Here is the background. Mr. Jensen has recently started insulin for his diabetes. He is now alert and oriented. He did eat a good breakfast on both days. My assessment is that I am concerned his blood sugar was 77 at 9:30 and I feel that his morning dose of regular insulin might be too much. I recommend that we lower his regular insulin from 70 units to 50.
As a physician, this is what I might be thinking. I just started Bill on insulin this week and this is a new medication for him. Since I know he had a good breakfast both days, I know it is not the food. Unless he has been vomiting. I will check with her to make sure. Otherwise, since he is lethargic 2.5 hours after he receives his morning insulin, I suspect that his regular short-acting insulin, which would peak around 9:30. Nurse Lee, has he been vomiting?
No, he has not.
Okay, I agree the regular insulin is too much. However, let's reduce the regular insulin 30 units to a new dose of 60 units and see how he tolerates this tomorrow morning.
Very good. I will write a new order in his chart to lower his morning regular insulin to 60 units every morning. Please come by and sign the order later.
Dear students, as you see, this dialogue was clear, concise and succinct. The hardest part for the nurse is to give you his or her recommendation. You as a physician do not have to agree with his or her recommendation, but realize this is a great place to start a healthy conversation. You can understand where they are coming from. I will now give the nursing student this verbal feedback.